Hey, welcome back to the Pain Education Series with Atlas. So far, we've talked about pain with a few scenarios, and we've learned that attention, cognitive appraisal, and reaction all impact pain. We've also recognized that tissue damage and pain aren't exactly equal, and pain is essentially an alarm system that helps us perceive threat to the body. These are all important points when we start to look at chronic pain. Chronic pain is pain that lasts for a long period of time, so typically greater than about 3 months. And we started to see that, given research that the body does a great job of healing with time, the alarm system or that threat perception in these chronic pain patients gets dialed up a notch. Things that maybe not previously wouldn't have been painful are now becoming painful. So what can we do about that? How do we turn that alarm system back down? Well, when we come back to attention, if all we do is look at our pain, we focus on our pain, it can negatively impact that intensity level. Whereas if we distract ourselves with things throughout our day, we participate in activities, we do different things, it can take our mind off our pain and essentially turn that volume button down a little bit. Further, we can rationalize with it or cognitively appraise what we're going through. So if we kind of start to think that the body's done a good job of healing, we're not dealing with an injury or pathology at this point, we can start to move our line of thinking to we can participate in things. Pushing into pain is okay. And doing things that may aggravate us for a short amount of time isn't going to be the end of the world and make things a whole lot worse. So now you can start exercising. Now you can start going out and doing things with friends, all sorts of things. And lastly, how we react is really important. So if you start thinking about coping, there's lots of different things you can do to kind of manage the stressors and things you go through in everyday life that would impact pain. If you think of yourself as a cup of water, and you're just the cup, and the water that you would pour into the cup is the stressors of life, eventually you take on enough stressors and the cup is going to overflow and make your pain out of control. Now, you may not be able to change how much stressors at times in your life you're going through, but maybe you can increase your ability to cope with those stressors. So build yourself up to be a bigger cup. So can you start to develop skills that help you cope with those stressors, such as doing a better job getting sleep, eating a better diet, maybe doing some mindfulness training. There's lots of different things, and there's no right answer. For just doing what fits best for you is the important part. So again, there's lots of ways to impact chronic pain, but when we look at attention, cognitive appraisal, and how we react, those can greatly help us start to develop tools and tricks to help manage that. Thanks for watching, and we hope you found this helpful.